headache is actually the most common symptom that people come with to a neurology OPD. And, more than 90% people will have headache at some point in their lives. But it's important to note that most headaches are non-serious. There are two basic categories of headache. One is a primary headache and the other is secondary headache. And majority of headaches are primary headaches, which are non-serious headaches. So in these, any test that you do would be normal, and the exact mechanism is not known. They're thought to be because of certain chemical imbalances in the brain. It's the secondary headaches that one is more worried about, because these may indicate something more sinister like a tumor or a brain hemorrhage or some such thing. So, but luckily most headaches are primary, and the two main types of primary headaches are tension type headaches and migraine. So tension type headaches almost everybody has at some point in their lives. They may be due to stress or overexertion or lack of sleep. And the other second most common primary headache is migraine, which is also fairly common. And, these account for most of the headaches that people come with to a neurology OPD. But as we progress in the talk, I'll talk more about secondary headaches, which can be serious. Okay. So both these headaches are actually diagnosed by the way one describes the headache. So a migraine would typically be a severe headache. It can be one-sided or all over the head. There would be, like a throbbing or a pulsation in the head. And it's usually associated with things like nausea, vomiting. The person is more sensitive to bright light or loud sound. They want to just rest, lie in a quiet room and, where there's no noise. And the other thing, and also there are some particular triggers for a migraine. These are the typical characteristics. So it's really the way you describe the headache that diagnoses it. And also you have to rule out secondary causes. So the tests should all be normal. A scan should be done at least once to rule out any secondary cause. Yeah, so the most important test is imaging of the brain. Imaging means either a CT or an MRI. The doctor will first examine you, and if they find something on examination, they might want to straight away go for an MRI. But in many cases, they may just advise a CT, especially if they're not suspecting anything much on it. But MRI is a better test. So if there's any doubt that it could be something other than migraine, then they may ask for an MRI. Changes in your lifestyle can also make a difference to your migraine. So if you remain relaxed, if you avoid stress, you keep sort of a regular routine with regular eating habits at a fixed time, sleep on time, get your 7 to 8 hours of sleep every night. All these help to bring down the frequency of the headache. And most people will only get occasional migraine episodes where they can just deal with it with a normal painkiller. It's only when it becomes frequent or very severe, it's not responding to the usual painkillers, that you need to consult a doctor.